All right, we're going to go ahead and get started since it's right at 10 o'clock this morning. Thank you all for joining us for our joint media healthcare availability. Today we have folks from St. Alphonsus, St. Luke's Health System, and West Valley Medical Center. Dr. Stephen Nemerson will start us off. He is the Chief Clinical Officer for St. Alphonsus. He will be followed by Dr. Joshua Kern, St. Luke's Vice President of Medical Affairs, Dr. Richard Augustus from West Valley Medical Center, the Chief Medical Officer, and Dr. Kenny Bramwell from St. Luke's Children's. He is the medical director there. We ask that you go ahead and keep yourself muted until they're done doing their short presentations, and then we will have plenty of time for Q&A, and at that time, you're welcome to unmute yourself and turn on your cameras. Please just let us know who you are, where you're from, and then who you would like to direct your question to, and we'll get to those as soon as we get started on that. Let's start now with Dr. Nemerson. Good morning.
Good morning, and thank you for letting me join this important news conference. This morning, I want to share with you some data that is already available on our website that has been posted now for weeks, but you've seen the trends in data, and I wanted to highlight them because of deep concern that we have that our community is now entering a third stage or surge of coronavirus. So Anita, if you can share my first slide. Thanks. The next one. Anita, the next one, if you can make it bigger. Well, I'm sorry for the size of the slide. I'm not seeing it increase on my screen. While we're waiting, though, I will speak to it. And what you see, and on my screen, it's a small slide. On the left-hand side is two diagrams. The first showing an increase in the number of new COVID cases in our community. It's the tail end of the Central District Health slide, which we're also seeing in other areas of Idaho, where we're beginning to see another increase in the total number of cases. And then the second diagram for the entire state of Idaho, what you see is a significant increase and with an acceleration in the number of COVID-19 cases within our state. The metrics that we use include the total number of active cases per 100,000 population in Idaho. And for each county and region of our state, the number 50 is the magic number below which the spread of COVID is considered to be moderate, above which the spread of COVID is considered to be high. So if you use that number 50 as a reference point, right now, Ada County has got a prevalence of approximately 302 cases per 100,000, Canyon County 245, and other areas still over 100 cases. So that means we have high prevalence in our community and it's increasing. So that's deeply concerning to us that we're moving into surge. Anita, I don't know if you can jump on and make sure that you hear my audio, but are we able to advance to slide number 3? All right, I see me. We'll see if we can.
Yeah, I'm working on that. Just one second. Let me try that one more time. It's showing here, but are you seeing it now?
I'm not, no.
Okay, we'll try one more time for you. Hang tight. The joys of technology here.
We just have a big picture of Steve, and he looks great, but.
Thank you very much. All right, we'll try and get the technology working again.
We got it. Here you go. Is this the slide you're asking for?
Well, I see joint healthcare media availability with the list of speakers at the moment.
Okay. Thanks for your patience, folks. There you go. You should be seeing it now.
Okay, I am. Actually, if we could go back to slide 2 so that I can give a concise description again. Excellent, thank you. So as I was sharing with you a moment ago, we healthcare leaders across the state of Idaho are deeply concerned about the increase in COVID-19 prevalence within our state and within our local health districts. What you see on this first slide is the prevalence of COVID as of October 12th. The first part of the slide on the left is the Central District Health data of cases. As you know, back in March, when we first began with the pandemic, there was a little tiny road bump. The prevalence of COVID was controlled by virtue of shelter at home. Then in late June and early July, with a liberalization, if you will, of movement as we moved into phase 3 and 4 of reopening, we saw a massive surge of COVID in our community. And then that was brought under a degree of control by virtue of some mask mandates and pleas to the public to begin more aggressive physical distancing and control within businesses and other locations. We did not get down to the lower incidence of COVID that we'd seen previously, and now we're seeing a significant uptick in COVID volume in our community. As you look at the graph on the right, you see the same exact phenomenon, not a surprise, but what you also see is an acceleration in the amount of COVID in our community, which frankly is frightening. So if you look at the next slide, what I'd like to share with you on slide 3 is the experience that St. Alphonsus Health System is now having. Anita, I don't know if you can jump back to slide 3.
It should be showing on your screen.
It's not, it's still highlighting slide 2.
We'll try one more time.
Thanks.
It may be a little delayed as well.
Sure. Excellent. Thank you, Anita. I hope others can see the slide. So this is our current experience at St. Alphonsus Health System. You see back in April, that little road bump that I was talking about, the black line being our inpatient hospital census, very manageable. Then you see that massive mountain occurring in July. That was the robust surge that we saw. And now you see, again, a rise starting from a higher position, which is the early part of COVID surge in our community, as reflected in inpatient hospitalizations. And again, today, we're seeing an increased number of inpatients with COVID throughout St. Alphonsus Health System. What's most frightening about this is 2 things. One, the position from which we're starting. We're not starting at near zero, we're starting at a moderate prevalence in the hospital. So we're concerned about that. Circumstances are still manageable, but what we don't know is how fast this is going to accelerate and how high the mountain of surge is going to be. And we're quite concerned knowing that back in July, we reached the point where all of our health systems needed to reduce medically necessary procedures and care in order to accommodate that COVID volume, that we know we're going to experience the same phenomenon and it may be worse. Now, if you could jump to the last slide, Anita.
We will get to it, just one second. It seems to work best this way.
Thanks. Thank you. The 2 other things we look at are something called test positivity rate. And I believe you've heard these numbers before. Anytime the number of people being tested for COVID are testing positive at a rate greater than 5%, that's considered a condition that is out of control. And our current test positivity rate is over 12% at St. Alphonsus. And the RT is the growth of COVID in our community. The green zone is less than 1, the yellow zone up to 1.5, and we're reaching, not quite, but we're getting to the point where we're worried about crossing into the red zone, where again, the growth rate is out of control and there's a possibility of overwhelming the healthcare system. So again, I'm personally very deeply concerned. I want to make sure that the public is aware of the current situation. I want them to have confidence in us that we're, 1, being completely transparent, 2, that we are fully prepared to accommodate whatever volume comes our way, and 3, know that we are pleading for the public and the community to get together and recognize, as we look at that data, it shows clearly that face covering, physical distancing discontinuing social events. These are the maneuvers by which we can get this back under control before it explodes. The last thing that I want to talk about is the importance of flu vaccine and the basic home supplies that people should have as they're considering the upcoming winter season. Combined with COVID, respiratory illnesses like pneumonia, like flu, like the common cold, and like other things that we're used to experiencing during the winter, they take increased importance because they set a person up for having a worse situation if they get COVID on top of that. So I cannot emphasize enough the importance of getting your flu shot this year. Now's the right time, and they're readily available throughout the community in multiple retail locations and physicians' offices. So go now, get your flu shot, protect yourself so that you don't get flu in addition to COVID. And then the last thing is, over the past 6 months, we've learned how to manage COVID better without requiring hospitalization. We do that through ensuring good nutrition and good hydration, good communication using telehealth platforms with your physicians, which we have obviously within St. Alphonsus Health System. But there's some tools that you should have in your home that I would encourage everyone to take a look at and make sure that they have them readily available and working. The first is a working thermometer that's accurate. A second may be a blood pressure cuff, not essential, but a nice thing to have if somebody has a chronic condition, particularly heart disease, to know what the blood pressure is. The third thing is scale. Many medications are dosed by weight, and so having a scale in your home is very helpful. And then the last thing, pulse oximeter can be helpful, again, for somebody that has a chronic disease or is going to get very sick with COVID or another illness superimposed, to be able to monitor their blood oxygen. These things are very inexpensive tools, fairly readily accessible, that I'd encourage people to have at home. And then I guess the other thing I'd mention, of course, is having a working computer with a camera is tremendously helpful to be able to use the telehealth technology that we have available. So those are the things I wanted to mention. Thanks for working with me as we went through the slides. Please know that our system is accessible 24/7 for any concerns or questions. And now I'd like to hand it over to my colleague, Dr. Joshua Kern.
Yeah, thank you. As mentioned, I'm Dr. Joshua Kern. I'm the Vice President of Medical Affairs for St. Luke's out here at Magic Valley, Jerome, and Wood River. And my intention today is kind of highlight what's happening out here in Magic Valley, given that we're becoming, again, one of the hotspots for COVID in Idaho. We've seen pretty significant rises, about 40% average week over week the last several weeks here in the Magic Valley area. And one of the things that's different this time compared to some of our earlier outbreaks is the majority of the cases are not just in Twin Falls County, which in earlier outbreaks, it was centered in the higher urban dense area in Twin Falls County. But what we're seeing now is a pretty high number of cases in all of the counties in the area that St. Luke's Magic Valley treats or takes care of patients in. So we're seeing Kaja, Minidoka, Jerome, and Gooding counties all having higher cases than they had in the past. What that's resulting in is then increasing number of patients in the hospital. We started this week with over 40 patients with COVID in our hospital, which was about a quarter of the total census, which for any medical providers, that's just an unprecedented thing to say that a quarter of the people in your facility are from one infectious disease. Today, the numbers have come down a little bit. We discharged a lot of patients yesterday, but it's still a very high census and concerning trend. You can see the blue bar there that's being shared from our external facing website shows the number of patients in the hospital each day, and the higher numbers the last several days just kind of relentlessly marching up. We're now reaching record numbers of patients in the hospital with COVID. We never had as many as 40 patients with COVID. Even during our big surge back in the beginning of this, we had a big outbreak up in Sun Valley, Blaine County area, and ended up absorbing a lot of those patients into the hospital here at Magic Valley. And we still never reached the number of cases that we currently have. I don't really see the cases starting to come down in the community, and the hospitalizations lag roughly a week. So if I look ahead, you would predict we might see another 40% rise of the patients in the hospital, up into the range of 50 plus COVID patients in the hospital, which is, that's an alarming number. It gets us pretty concerned about where we're headed. Again, what we've seen and what was highlighted by Stephen is that we can get control of this, right? We had a big outbreak in July. We had an outbreak here at Magic Valley during that same time, but as the community started masking and taking more precautions, we really saw controlled numbers into August and the beginning of September, and really we're doing okay until I think people started relaxing and getting less controlled with their activities in the community. The other thing I'll highlight, recently news that we've had our first reported case of a person being infected for the second time and needing hospitalization here at Magic Valley, that I think was being reported in the news today. This is, some of the concern about this virus is that it does not seem to give permanent immunity, and we are getting, seeing around the world re-outbreaks 5-ish months after initial outbreaks. And so there's a lot of reasons why we need to continue to protect ourselves to keep our health systems from being overwhelmed. We are taking extra precautions here at Magic Valley. We have actually needed to call in support from physicians in Boise because we've had enough patients in the hospital that the unprecedented step of having to get support from an outside facility is occurring. Our staff is going okay. Our total number of beds is being strained. Nursing staff is tight because of the volumes of patients. And then finally, the last thing I'll say before I pass it on is we're also seeing influenza in the hospital already. We've had several influenza patients we've admitted, including co-infections between COVID and influenza now at Magic Valley. So to reiterate the earlier message about getting your influenza shot, now is the time. Influenza is in the community. And given that we know that coronavirus is spreading more aggressively than we would like, that suggests to me that we're all at risk for getting influenza at this point as well. So I will pause there and pass over to Dr. Augustus.
Good morning, everyone. My concerns are that we're getting a long ways into this infection. People are getting sick of hearing about it. We're getting tired of social distancing. This event is analogous to a marathon, not a sprint. We are nowhere near the finish line at this point. We have to redouble our efforts. We've got to start to focus again on the basics. It is not the time to give up. We are certainly looking into the holiday season now, and it's just going to be different than what we've experienced in the past. We have to accept that this year is going to be different. We can't do things as we've done them before. Halloween can be managed as a low-risk event, or we can try to be normal and we can have a high-risk event and spread the virus around the community. And with the trends that we're seeing in the community, this is not the time to relax. We need to be careful. We need to use the tips that we're being given. The CDC has published some guidelines. I think Anita has included their handout with the information today, but trick-or-treating is a high-risk event. I would not recommend it. We really need to be careful. Do something different. Do a costume party at home, have a movie night, do a scavenger hunt, do something within your household contacts. Don't go outside and trick-or-treat as usual. This is not the time. Do think outside the box, do something creative, have some fun, but be careful. We're gonna have to look at this for Thanksgiving and Christmas, we cannot give up. It is not a point in this pandemic that we can stop being careful. So I know we're tired. I know it's hard to wear that mask. It's hard to wash our hands. It's hard not to be in social contacts, but we got to do it. So we just need to buckle down and try to support our community in a healthy environment. And if we work together, we can do this. So we just need to follow the guidelines. So I'll turn over to Dr. Bramwell.
Thanks, Richard. So I appreciate hearing from my colleagues already. And these are difficult times, trying to figure out how to navigate through all of these changes and through all of these surges. These are hard things for all of us. This year has been challenging so far, and it continues to be challenging in different ways. One of the things I wanted to draw attention to is the idea that this doesn't really affect children. Sadly, we have had a few dozen cases of COVID that have required hospitalization of children here locally. We have had a few cases that were in the most severe category, that is MISC, or multisystem inflammatory syndrome in children. One of the cases was severe enough that the patient ultimately needed to be taken in an airplane to another city to await a heart transplant. This was a previously healthy teenager who now is going to have a heart transplant. So while COVID is commonly inconsequential for many people, there are a subset of people who become exceptionally sick. Sometimes it's sick enough to require a heart transplant. Sometimes it's a chronic problem where somebody has difficulty breathing or moving around their home or doing their normal activities for months. We're having many patients who have these sort of long haul symptoms, which are really, really difficult for them to navigate. We understand that this year is going to be different. It's been different almost the entire year so far. Halloween is an upcoming holiday, and much like my colleagues here, I wanted to draw attention to some ideas that we have for Halloween. It's not so much that we want to cancel Halloween or we want it to be unpleasant, but we do want people to think about it differently. You know, with this virus and with some of the problems of how contagious this virus is and how easily it spreads between people, what we want to do is change the way we celebrate Halloween from it being outdoors and large groups and close contact to a different approach. What you have on the screen here are some ideas for activities that are lower risk than large groups on a hayride or in a corn maze. You can pivot and change Halloween to being a more intimate affair in your home. Scavenger hunts come to mind inside the house, looking for candy. You can certainly carve pumpkins and do other sort of lower key activities that don't involve quite so many people. So our goal is to try and change this from being an outdoor grouping of large numbers of people to a more intimate holiday. On the screen, what you see now are some moderate activities. You have small groups involved. You have outdoor as an option. Really, the thing to avoid are the really large gatherings or large costume parties or large groupings of people inside. And if we can go to the next slide, we'll see some of these high-risk activities. Door-to-door trick-or-treating is concerning mostly because of the overlap that you will have with other people, and because commonly people will opt not to be masked. That's a concern with Halloween as well. Trunk-or-treat parties where there are dozens or hundreds of people in close quarters is something we feel is also high risk. Large costume parties or dances similarly represent a great way for the virus to be spread between people, which we're asking people to avoid. And again, we're trying to have people avoid alcohol or drugs just because of how that tends to impair solid judgment. So what I'd like to emphasize with those things is that we still want Halloween to be fun. We would just like you to consider ways to make Halloween a little different. Rather than it being large groups in close quarters, try and come up with ways together with your children to make this safe and still enjoyable. And with that, I'd like to open it up, toss this back to Anita, and see how we can answer any additional questions.
You bet. And everyone, I want to let you know, I sent the newsrooms the copy of those Halloween safety tips, so you have those. Please share those widely with folks. If you have questions, feel free to unmute yourself, ask your question, or you can use the chat feature to ask your questions as well. We can start with whomever would like to go first.
Hi, Anita. It's Ariana Piper with CBS 2 News. I was just wondering, this is directed to any of the doctors. Do you think a lot of this spike is from kids going back to school? And if so, are you concerned about kids being in school? Do you think it's important kids are in school? And as long as they follow the safety precautions, just kind of what's your thoughts on the school year starting and how that's been going?
Ariana, maybe I can take that first. First, let me start by saying, yes, in-person education is really important, and we recognize that discontinuing that has significant consequences, and there's many major benefits to being able to, for students to gather together. So we don't take recommendations to reduce that lightly. However, the data is very compelling, and it seems clearly associated with two things, the surge that we're experiencing now. The first is the Labor Day holiday, in which people presumably congregated having social events like backyard barbecues. These are the principal mechanisms by which COVID seems to spread in the neighborhood setting. And then the other is the in-person education in schools. We know that within the under 18 age group, that over 10% of the kids in our community who are being tested for COVID are testing positive. So the incidence of COVID among young people is quite high and concerning. And the other thing that we know is that kids tend to be asymptomatic or have very low level symptoms where they won't be caught on screening because they don't have symptoms. They then get together with one another and spread the virus. And it can spread quite a bit because the only time it will be noticed is when somebody gets really sick from it. So our recommendation is that the school districts obviously consider the surge that we're in right now. And then secondly, really critically important, and we made this statement as a group of chief medical officers well over a month ago, it's critical that the plans that the schools have in place actually be followed. So compliance, particularly among young people, can be variable, and really holding the kids to the responsibilities that they have to keep their masks on, separate from one another, and not spread the virus as a result is incumbent upon the parents to reinforce with their kids.
Awesome, thank you.
And then I have a
Has her hand raised. We'll start with Audrey Dutton, who has her hand raised. Thank you.
Hi, thanks. This question is for Dr. Kern. I'm not sure if I understood correctly what you were saying. Has there been a confirmed case of someone being reinfected in the Magic Valley? And if so, can you tell us more about that? Is it confirmed that it is a reinfection? And
yeah,
is there any timeline you can give us?
Yeah, it was brought to my attention actually via the media. So I guess I have not confirmed this with our providers here, but it was reported in the media, a patient who was admitted to Magic Valley who reported having the virus back in March and having it again and needing to be hospitalized here recently. So I can't tell you what media outlet it was because I can't remember right now, but that is being reported on, and there's interviews in that.
Rachel Cohen, go ahead.
Awesome. Yeah, so I have a question for Dr. Kern specifically, but any of you guys can answer this. Are you guys testing asymptomatic people or just symptomatic people?
Most of our testing in asymptomatic people is before surgeries. That is the primary reason why we would do asymptomatic testing. For the most part, most of our testing is testing symptomatic people, consistent with what I think most of the healthcare providers in Idaho is, in part because we just don't have enough testing supply or resources to do wide-scale asymptomatic testing the way that I think many of us in the long run feel like would be optimal.
Gotcha, thank you.
If you have questions, go ahead and jump in and ask them.
Hi, this is Rachel from Boise State Public Radio, and my question is also for Dr. Kern. So in July, when the Treasure Valley Hospital leaders came together to convey an alarming increase in hospital admissions due to COVID-19, you know, they had specific asks for the community, and then there was a sense that some of those measures worked in, at least for the time being, bringing down hospital admissions. And my question for you is, in a health district in which, you know, those sorts of mandates have realistically never really been on the table, what is your ask of the Magic Valley, both the community and the elected officials, and what's your message to them about what is at stake?
Yeah, the history of COVID in the Magic Valley has been a little bit different than the experience in Treasure Valley. We have seemed to always just have a little bit more per capita cases, but hadn't really had the same big surge that was seen in Treasure Valley. You know, some big outbreaks associated with bars opening that was well reported on. And that resulted in Treasure Valley, I believe, going back to stage 3 and closing bars there for a bit. So in Magic Valley, we have not had the big high surges like that. We've continued to just kind of have moderate amount of cases, fairly manageable. I would say anyone that lives in this community has seen the use of masks waxing and waning. We're currently in a down period for the use of masks in the community. I think if you think back to when our cases were pretty low here late August, you saw a lot more masks than you see right now. So that's my main drum to beat is, hey guys, we did it before. We can get the COVID spread under control, and it's done through wearing masks. And I think limiting social events. I mean, that's the other thing we've seen is an uptick in some really big kind of public social events in the community that were, at least the pictures on social media seem to imply there wasn't a lot of mask wearing. And that, what I've seen and what I've talked about with schools going back in session is what we've seen a change in behavior towards normalcy. With kids being back in school, I think parents and kids have started just trying to get back to completely normal because it feels so normal to be back in school. And I'm suspicious that's where we're seeing the uptick in cases. I haven't been under the impression there's been a lot of in-school spread of the virus because they're really wearing masks there, but it's the behaviors associated with going back to school that have helped increase the cases.
We have a question from Shira via the chat. It says, Dr. Nemerson just touched upon school-age children when it comes to COVID-19, but who is contributing to the increase in these cases we're seeing overall? Is there a particular age group?
I guess I could follow up on my comment to say that we see about the same test positivity rate across the board between the ages of, say, 5 years old on up to the age of about 60 years old. Test positivity rates plus or minus a couple percent, around 10%. So anywhere from 8 to 12% within my system. So it really has to do with the fact that younger folks, there are a larger number of them. They have a significant number of those who are positive for COVID, but are not symptomatic and therefore not known to be at risk of spreading the disease to others. And that's principally how we believe that it's being spread, is by younger people who are not symptomatic, and similarly who are bringing it into their home and then spreading it to others. And that's what we've seen in the other two surges is, generally speaking, it's young children and adults who acquire the virus first and then give it to older folks who have much more complications with it, higher likelihood of being hospitalized and becoming severely ill.
Audrey Dutton, you have a question. Go ahead.
Yeah, we're seeing, and this has been the case since summer, we're seeing these surges at various parts of the state, at various points. It's sort of up and down all over the place. Currently, Eastern Idaho, Southern Idaho. What, if anything, could the governor do to help get these outbreaks under control at this point, in your opinion? Dr. Augustus, could you maybe jump in?
So, I don't know if the governor really is the one who needs to do this. He's one person, and we all have responsibility to take care of it within our sphere. There is a lot of pushback about mandates, and the sad thing about a mandate, if it doesn't come with enforcement, it's not going to change behavior. The reality is we all need to take personal responsibility, and we need to behave in the way we know is going to make an impact, which means social distancing, wearing our masks, and washing our hands and being individually responsible. That's what's going to really make a difference.
We have another question via the chat. When it comes to the Magic Valley, are there any concerns when it comes to high school games like football games?
Yeah, I think any events where people are packed tightly together and not wearing masks, it's concerning that the virus could very well easily spread. I think, we've had at different points during the summer some relatively large events that were outside where we didn't see definitive evidence that there was a widespread spread of the virus. But again, I think that was more luck than skill. I think we're continue to be at risk, particularly as the weather gets colder and everything is moving inside. And if people are not wearing masks, then again, yeah, I see just unfettered spread of the virus, especially if what we're going to see is people who already had it in March and April are going to be at risk for catching it again. Then it becomes a never-ending cycle, and why we need to take control of it. And I tend to agree with Dr. Augustus, that happens with ourselves in our immediate spheres and then spreads from there.
We have another question that came through via Facebook. It says, how can we really know how much schools are contributing to spread when so many children, especially younger children, can be asymptomatic? Dr. Bramwell, can you kind of touch on children since you've been advising some of the school districts?
Sure. So I'll share with you on my other computer screen here, I have a spreadsheet of all of the schools in the state and the number of cases that they had during the week of September 25th through October 1st. I believe these data are being published weekly. So you can look and see exactly how many cases or how many students have popped positive at each of these schools. And it's really pretty interesting in the sense that there are some schools that have had higher numbers than you would expect based on sort of the population at those schools. And there are also a lot of schools that haven't had any cases. Without forcing anybody's hand, it certainly seems that the opening of schools with measures in place to mask and to distance is making the schools safe. Kids don't seem to be getting lots of illness from school when they are practicing the things that we are emphasizing here: the social distancing, the hand washing, and the wearing of masks. We are very certainly concerned about this, and we're watching this week to week. But so far, the schools have not been a big source of COVID cases.
We have another question online. It says, how come the red states have higher infection rates than blue states since June? Data shows this. I'd say it's because there are no mandates or enforcement. What do you think? There's a little bit of a commentary in there, but what's your thoughts based on the data?
The answer to this question, of course, is fraught with it getting politicized, but I think without making really any political commentary, my experience is out here in Magic Valley, much more skepticism about what is reported, questions about the veracity or the truthfulness of the information available. And, you know, here we are, the hospital administrator saying, no, really, there's a lot of people in the hospital, kids getting really sick and needing heart transplants is real. I don't know how to tell you that any other way. And so I do think it's widespread mask adoption. Mandates maybe can have a help. In Arizona, they saw a 75% drop in cases after a mask mandate and bars closing down, which was just published via the CDC, and there's some media about that, but pretty interesting results in a more skeptical state that did do a mandate and saw a big drop in cases when they were having a big outbreak.
Dr. Bramwell, another question for you related to MISC. There may be some people who don't know what MISC is and the seriousness of it. Can you just touch again upon that and provide us any other information about how someone who is healthy can go from being healthy to being in the ICU to now needing a heart transplant?
Sure. So MISC is a relatively newly defined disease. It stands for multisystem inflammatory syndrome in children. And it's defined as a patient who is between or 21 years of age or less. It is someone who has got a COVID illness, someone who needs to be in the hospital, and then once they're sick enough to be in the hospital with a COVID-based illness, then they have to have multiple systems involved, such as the pulmonary system or the renal system or the gastrointestinal system. So they have multiple body systems that are inflamed or struggling, and then they have to have laboratory confirmation of significant inflammation inside the body. So the challenge with these cases, again, these are patients who are less than age 21, is that they tend to be the sickest subgroup of children with COVID. We've talked earlier about how the majority of children do exceptionally well and stay at home and manage their symptoms without too much difficulty. But for a small subset of patients who develop this MISC, there is some degree of fatality associated with it. There's also many of these children who require prolonged period of hospitalization. We've had in the range of 5 to 12 days so far. And there are also some patients who stay sick enough that they ultimately need, like our case earlier, a heart transplant or ongoing critical care for a prolonged period of time. So the people who are at most risk for this and the people who are going to get this, we're still trying to figure that out. We don't yet have a great handle on which kids are going to have sort of a devastating outcome, but we're trying to figure that out as we go.
We have two questions via chat. Stephanie asked, when it comes to the Magic Valley, are there any concerns when it comes to high school games like football games?
actually think I answered that one already.
Oh, you did. Look at that. Let's go to Rachel's question. Thank you. I have sources telling me that college students are purposefully getting COVID-19 so they can then sell their plasma. What would you say to those people?
This is a bad idea.
I think I can answer a little bit to say that if that's really the case, and I had not heard that myself, they're going to be sorely disappointed. Convalescent plasma that's used for research or experimental based treatment of COVID-19, we are partners with the American Red Cross to do that, and the American Red Cross does not pay for blood donations. So a student that would think that they might be rewarded for their plasma is going to be sadly disappointed. The other thing that I would say too is that fundamentally, purposely getting COVID-19, as we've described here, it's a game of Russian roulette. And while a young person may only have a 1 in 1,000 chance if they get COVID of dying from the disease, I wouldn't want those odds for any patient anywhere. And that is not a game to play.
I'm going to open it back up to media in case they have questions, but I'll keep asking a few questions that we're getting in online as I wait to see some hands raised. Going back to the symptomatic and asymptomatic testing, if you could address whether or not your organizations are considering reopening the testing tent sites that we got so used to seeing at the beginning, and why or why not?
So I can speak for St. Alphonsus to tell you that we never closed our tent testing sites. We still have 2, we call them fever and upper respiratory infection clinics, which include a medical evaluation and drive-through testing at our Garrity and Meridian Health Plaza locations. So we've not closed those down. In fact, with the surge that we're now experiencing, we're looking at expanding our testing capabilities. The challenge, of course, is going to be during the winter. Those are not optimal locations to be tested at, and we're trying to figure out how to bring testing indoors into a warm and safe environment.
Dr. Kern or Dr. Bramwell, can you explain St. Luke's testing process at this time?
Yeah, I can speak to it a high level. I know we're wrestling with the same things of how to do this during winter when it gets cold and keep people safe so that, you know, we're not exposing unsick people to people that potentially have COVID. Any patients in St. Luke's are supposed to have masks on and be protecting each other and our staff, but you know, we want to take the highest precaution we can. We stood down the testing tents in a lot of ways, but in many areas the difference was pretty subtle because we still have car testing, and it looks a little different, but it's not that different. It's sort of tent testing by another name. I don't believe we've had conversation about setting up the true sort of drive-through tent testing we had before, but as mentioned by Stephen, is that we are also looking to expand our testing capability. It's sort of the push for everybody is to get more testing available and out there.
Thank you, Dr. Kern. Do we have any other additional questions before we go ahead and wrap things up today? I'll leave it open here in case anyone wants to jump in. All right, well, it looks like we are all done here today. Thank you all so much for making time for this and kind of laying some of this information out for us. We appreciate everybody joining us, and we will see you the next time.